first speaker is Jason Redhead, who has kindly pre-recorded his presentation as he could not be here live today. Jason Redhead received his Bachelor of Physiotherapy at Otago University in New Zealand. He is currently employed as a Senior Physiotherapist and Assistive Technology Project Leader at Royal Rehab, New South Wales. Jason has a keen interest in neurological physiotherapy and has been working in this field for 11 years, initially with stroke, Parkinson's disease, motor neuron disease, but more recently over the last 8 years working with spinal cord injury clients in both inpatient and outpatient settings at Royal Rehab, Sydney, Australia. Jason has always taken an interest in different technology options available for physiotherapy, from different therapeutic devices to FES and mobility aids to help improve intensity of therapy and client engagement. When the opportunity came for Jason to be trained as an EksoNR therapist, Jason was very excited. Jason has seen the way he and his team provide therapy both in and out of the EksoNR at Royal Rehab and adapt as they embrace this new robotic technology. Jason has also been involved with student and clinical education, as well as supporting local research projects for spinal cord injury. Today, Jason will be introducing the EksoNR. Thank you, Jason.
Hello, everybody. My name is Jason Redhead. I'm one of the physiotherapists at Royal Rehab, and I'm going to present to you today regarding the EksoNR exoskeleton. It's a product that is made by Exobionics in America, and we've had it here at Royal Rehab since October of last year. I'll just talk through the device and indications and some limitations for the device, and then I'll talk about some of the research, and at the end I'll talk through a case study as well. So what is the EksoNR? It is a clinical device first and foremost. As we often say, it's one of the tools for the physiotherapist in their toolbox. It's a device that must be used in a clinical setting under the supervision and guidance of trained exophysiotherapists. It's a wearable exoskeleton, so we adjust the device to fit the client, and we get the client into the device to use it as part of their therapy program. It's operated by 2 batteries, and those 2 batteries control 4 motors. So you can see on the picture there, there's sort of a microphone just above that blue circle. There's one of those on either side, and that's the 2 hip motors. And then if you come down the leg a little bit further, you can see there's 2 little what look like microphones again, and they are the knee motors. So between those 4 motors, they allow people with lower limb weakness, paralysis following a neurological injury to stand, walk, move, and participate in therapy using this exoskeleton. All movement within this exoskeleton can be initiated in 2 different ways. One, through specific movement of the client, and I'll talk about that in a second as to how that is done, or it could be done through passive movement, and that is done by the device, and the clinician will generally use the controller to activate that. So at the moment, the EksoNR is used in 30 countries across the world. Australia is country number 31, and it's used in 270 facilities worldwide. And Royal Rehab at the moment is the only facility within Australia. It also has FDA approval here clinically. So I guess just to start with some of the limitations, but also more so the screening that we do before we get somebody into the device. So as I mentioned, it's not for personal use. It is used within the clinic setting. For somebody to get up into the Exo, they need to have what we deem safe, healthy bone density. So they need to be able to safely stand and or walk as part of their normal therapy, ADL, or exercise routine. We do require medical clearance, and there's sort of set criteria that they need to go through to make sure that the client is medically safe to participate in a robotic physiotherapy program. A client must have the strength in at least one arm to use a walking aid. They can't have any unhealed fractures or untreated blood clots. They can't have more than grade 3 spasticity on the Tardieu scale. And in terms of their passive joint range, they need to be able to achieve plantar grade range at the ankle. And ideally, they need to have at least 10 degrees of hip extension. If they do have a contracture in the hip and they can't reach that 10 degrees, we can make adjustments, but preferably we want people at that 10 degrees. Clients need to be under 100 kilos in weight, and they need to be between 1.5 and 1.9 meters tall. So this is sort of our initial screen that we will do with clients. And if they meet the criteria from the screen, then we will organise a specific physio assessment to take that sort of baseline measures and measure them up to fit into the device. So some of the features of the EksoNR, it can be used for a wide range of neurological impairments, from people with stroke to Parkinson's to spinal cord injury, brain injury, cerebral palsy, Guillain-Barré. There's a wide range of people that can use this device. Anyone that has any type of neurological impairment in their legs or muscle weakness within their legs can use this robotic exoskeleton. It is a customizable fit. So we would measure the client up and we would set the device for the individual. It takes about 7 minutes to change between clients, and we can adjust that to fit a lot of different people. The EksoNR has some data on board. So you can see the therapist there in the orange, she's holding, and myself, we're holding a screen there, and that's the onboard screen, and that gives us auditory feedback, it gives us visual feedback, and allows us to change the settings while we're walking or standing or doing therapy in the device. But there's also an online database, so all of the information that is captured while using the EksoNR during a therapy session is uploaded onto the online database, and we can use that data for various reasons, and we can access that easily. As I mentioned, large adjustability for different body shapes, and it's easy to store. So it only takes up the space of a single chair. It weighs about 16 kilos in total, and it can be moved around. We have it sitting up on a sort of a trolley that we can move it around, and that client can sit straight onto that. So easy to transfer on and off, whether someone is transferring via a hoist or a slide board or an independent stand or pivot transfer, they can get into the device easily. The device is used for different gait training goals, and it does that through patterned, reciprocal, and repetitive pattern of stepping. It allows us to have the higher intensity of therapy that may not be able to be achieved with just using regular therapy on land physiotherapy. The benefit of the EksoNR is that it is promoted as a real neuro-rehabilitation device. So this is the second generation of the Exo, and this new generation does allow for clients who are using this device to do more than just walking. It allows to concentrate on weight shift training, balance training, and specific muscle training that may be specific to their impairments, to their function. And we can adjust the amount of assistance or resistance that we can offer to get them working in a more active assist or assistive mode of therapy. The device is controlled through sort of that robotic assistance, and it can provide assistance in either the swing phase of gait or in the standing phase of gait. And we can adjust the amount of assistance depending on how the client presents, from a fully passive therapy to active assist therapy to assistive therapy. And I'll explain that in a little bit more detail here. So just quickly going through how we can change the step initiation. Initially, we always start with what's called first step, and this is where the client needs to initiate the lateral and forward weight shift. And when they can achieve that, the therapist will initiate the step using that touchscreen controller. Once they've mastered that first step activity, then we can move on to pro step. So pro step, thus the client still needs to actively forward and lateral weight shift. But once they achieve that, the device will then trigger the step in that setting. Once they're managing that, we move forward into pro step plus, and at that point the client is actively doing both the lateral and forward weight shift as well as triggering the step themselves. So there's a progression of that step initiation as the client progresses in their EksoNR therapy. The amount of swing and stance support can vary. In swing phase, it can go from full support, so that's that max setting, or it can be active assisted or active in either of the adapt or fixed modes. The adapt mode, the amount of assistance will fluctuate and change as per the input that the device is receiving from the effort that the client is providing. In the fixed mode, it's like a ceiling value. So the device won't offer any more than what that fixed value we've set, but it can offer less as the client is able to do more active therapy. And similar with the support and standing, it can be fully passive support and standing, or it can be flexible support. So more active assisted, more active therapy in that standing phase. So looking at some of the research, it is one of the most researched exoskeletons in the world. There's over 74 studies that are completed purely on the EksoNR, and these studies have shown that people are able to achieve longer walking times, improve circulation, gait symmetry, gait speed, the distance that they can walk after a period of therapy using the Exo, and improving their mobility outside of the device as well as their balance. You can find more of the details of that research at the EksoBionics website. The site is there to access. But I'll go through just some of the recommendations as to where EksoNR therapy and where exoskeletons are recommended following stroke. So if we start with the Stroke Foundation, there is a strong recommendation in the Stroke Foundation for stroke survivors with difficulty walking should be given the opportunity to undertake tailored repetitive practice of walking. Now, this doesn't talk specifically about exoskeleton or other robotic devices, but what we can take from this is that the EksoNR exoskeleton gives us the opportunity to offer clients post-stroke an environment that they can carry out high-intensity, repetitive practice of walking. And it allows us to do that with less manual handling from the therapist, less fatigue from the therapist, less fatigue from the client. And it allows them to, what maybe would take maybe 20 steps in an overground walking session to maybe taking 200 steps in an EksoNR session. So using a robotic exoskeleton really does support this strong recommendation from the Stroke Foundation. Also from the Stroke Foundation, there is a weak recommendation for stroke survivors with difficulty walking that one or more of the following interventions may be used in addition to those previously listed. And the EksoNR exoskeleton fits into three of these interventions, including the electromechanically assisted gait training, which is what the exoskeleton is, as well as it provides feedback. So the virtual sort of palm pad device that the therapist use, there's so much feedback that comes from that, both visually and auditory. And so that feedback can really sort of cue into what type of stepping practice or muscle movement that we need to be focusing on. And clients have really commented that they've really appreciated the feedback that they can get from that visual and auditory device. It also gives a cueing of cadence. So the EksoNR has got the auditory sounds, and hopefully you'll hear that in a video shortly. And those auditory sounds really cue your weight shift and the timing in which you need to be taking that next step. So again, the EksoNR does support this weak recommendation to be having these interventions for those with difficulty walking following a stroke. Also from a Cochrane Library review, related to electromechanical assisted training after stroke. So they found that there's no evidence for one particular locomotor training strategy, but that locomotor training for walking in rehab after stroke might help to improve a person's ability to walk. However, there are many strategies that exist to achieve this. And one of those includes robotic assisted gait training, which we're doing with the EksoNR exoskeleton. And so just going through a couple of randomized control trials that continue to support the use of Exo. This is one from 2020 where they had 44 participants over 4 weeks. Their control was just your standard physiotherapy for an hour and 45, whereas the experimental group had an hour of standard physio plus 45 minutes of robotic exoskeleton using the EksoNR. And this study showed that both the control and the experimental group improved function and balance following each of their interventions, but it also showed that the experimental group using the EksoNR also had significant improvement on the Rivermead Mobility Index as well as the Barthel Index. So it really supports that idea that EksoNR, exoskeleton robotic therapy in conjunction with standard therapeutic care is achieving better outcomes. A very similar study from 2018, similar population, a little bit later, post-stroke, 11 months was the mean, and longer therapy time, this time 8 weeks versus the previous 4. Control, again, at same time in terms of conventional therapy, this time just overground gait training in the control versus the experimental, they had robotic gait training as their experimental group. They had a wide range of outcome measures that they used, and in both groups, it did show that they both achieved that mean clinical difference in all outcomes, but also showed that the experimental group that had the EksoNR therapy also showed significant improvements in the assessments for neuroplasticity. So again, similar guidelines that we can take from this is that the intervention of both standard physiotherapy and robotic therapy is achieving greater outcomes following stroke. So just to talk you through a case study, we've got Mo here. She's a 77-year-old lady, and she had a stroke back in July of last year. So she presented with dense left hemiparesis in the upper and lower limb. Just by way of background, she was the primary carer for her husband. She was living at home with him in their own home, as well as with their adult son. She was previously independent with no aids, independent with all tasks of mobility and her ADLs. She didn't have any formal supports previously, and she did have a good family network. So she presented to the acute hospital back in July, and she had a period of inpatient rehabilitation, and then she was discharged home 4.5 months after stroke. Her discharge wasn't to her own home, it was to her daughter's home, which was flat access. But at time of discharge, she was referred to a TACP package, which is where Royal Rehab became involved with her. So at that time of commencing TACP, she was walking with 1 times max assist as well as a gait belt. And she also used a 4-point quad stick. Her walking speed was slow, a small step length. She was vaulting during her swing phase, poor foot clearance, hip hitching, and she was circumducting her left leg through swing phase. Her strength on her right was full strength, and she had grade 1s and 2 strength in her left. Supervision was needed for all transfers, and her walking tolerance was approximately 15 meters. So she started with TACP. She had her therapy in the home, and she had all the conventional therapy at home. During the next sort of 4 weeks of physiotherapy at home, her walking tolerance improved slightly, and she was recommended to start a trial of the EksoNR. So on the beginning of February this year, she came to us and she was assessed to use the EksoNR, and you can see this was her in February. So really struggling to swing her leg through phase, not enough dorsiflexion through swing, assistance from her carer, to be able to keep herself balanced, a lot of reliance on that quad stick, very small step length. So she was referred for EksoNR therapy to really work on her gait pattern, to give her the feedback that she needs to improve her weight shift and get her to a weight being more on her right side, and to work on her posture and her walking speed. So if we flip now to the Exo session, there on the right, and you can see that by using the Exo, you can focus on the auditory sounds. Those beeping noises are the cues for Mo to make sure that she's getting the most suitable weight shift to allow a safe swing through phase. You can see that she's got better ground clearance during swing phase and better weight bearing between the left and the right. So she then went on and had a further 6 physio sessions and 8 exo sessions after that initial assessment. And that took her through all of February, March, and into April. And after those 8 exo sessions and 6 physio, she moved from that hands-on assistance and that support from her carer to just needing that close supervision. You can see her, she's just standing there at the moment, but you can see that her carer is just standing and not needing to provide any assistance. Hopefully this video will play. Yep. You can see that she's more upright with her walking. She's getting better swing through on that left phase. Her circumduction of that left phase has reduced, and she's able to walk faster. Her 10-meter walk test reduced from 50 seconds down to 38. She was a lot more confident. I remember with her, after her first session, she finished her session and she walked from the gym to her car, which was only about maybe 10 meters. And the smile on her face that she was able to do that without the assistance, just that sort of close standby support from her carer, was such a significant milestone for her. When she started with the Exo, she had increased her walking endurance from that 15 on discharge to 30, and she increased that a further 50 meters with the support of the EksoNR therapy. As a result of that combination of physio and exo, she was able to achieve some of her functional goals around the home. She was able to stand with more confidence and make a cup of tea for herself. And she was able to walk independently around the kitchen and be a member of her household with her daughter and her husband. So this is just a quote that I'll finish up with, and it's from a client. He was an 86-year-old gentleman who was very early post-stroke when he came to us. He was about 4 weeks post-injury, and he came in, he had 3 weeks of therapy with us, and he just said, after having a stroke, I was very fortunate enough to have the EksoNR therapy to correct my walking ability. I found the therapy enjoyable, and I believe the combined system of EksoNR and traditional therapy shortened my journey to recovery. So just some really positive feedback from some of the clients that we've worked with while using the EksoNR as part of their recovery following stroke. So if you think that's something that I've mentioned today, that maybe you have a client or you're a consumer that might be suitable to use the EksoNR, feel free to contact us. You can check out our website, royalrehab.com.au/EksoNR, or you can give us a call there on that phone number, and we can talk through options, whether they meet that criteria to use the EksoNR, and options around funding. Thanks very much, everyone.